The coronavirus pandemic has had a dramatic impact on the opioid crisis, not only in Chicago, but in the burbs as well, with a surge in overdose deaths over the past year.
Yeah, State Senator Melinda Bush from Grays Lake has been an advocate in the fight against opioid addiction. The senator kind enough to join us this morning. Thanks for being with us.
Thank you. Thanks for having me. Good morning.
Good morning. So this is a nationwide problem. It's not just a Chicago or Illinois problem. From September of 2019 to August of 2020, more than 88,000 opioid-related deaths. That is just astounding. How is COVID making matters even worse?
Yeah, whether it's isolation, higher depression issues, we're really not sure what the cause of that is. But, the fact of the matter is, in Cook County, I want to say we've seen about a 20% increase in deaths from opioids, and also in the suburbs. So it's, isolation, access to treatment, and frankly, doctors continue to overprescribe, even though we know that opioids are addictive and that they are causing death. Doctors continue to overprescribe. And, frankly, there's been recommendations by the CDC that when you're prescribing an opioid, that you should be also offering that patient naloxone, which of course is the antidote. So, hopefully this year we're looking at a bill that would require doctors to have a conversation with patients. How many times is someone prescribed OxyContin and frankly doesn't even know that they are being prescribed an opioid? So we just want to see more conversations from doctors, prescribing, co-prescribing, to make sure that if someone is given that prescription, they understand that it's an opioid, it's addictive, and we want to make sure that they have access to an antidote. But frankly, I think it's the isolation, where we're seeing people that are just not getting out and getting the help that they need.
Well, and when you talk about some of these drugs like fentanyl, synthetic drugs, fentanyl, very addictive, highly addictive, it is a reason for, concern. Do you think that doctors, get that?
Yeah, here's the thing. Obviously, we know that years ago, pharmaceutical companies were really pushing those drugs and many people became addicted. How many people do? I have friends that have died from substance abuse. How many people don't know someone? I think the doctors many times are still trying to deal with prescribing for pain, which in some cases it makes sense. But, I believe we still continue to overprescribe, and that there are some doctors who don't have the necessary conversations with their patients. When you're prescribing an opioid to someone, and I'm not talking when you're prescribing 4 or 5 pills because you just had some kind of surgery. When you're prescribing an opioid to a patient, the conversation should take place. A doctor should be talking to that patient. And for doctors that aren't doing that, we really want to make sure that that's happening. Frankly, it's another tool in the toolbox. We continue to see numbers of deaths rising. In 2018, we saw some flattening, but since COVID, we are seeing those numbers continue to go up. So we need to be more aggressive, and we should be talking more about fentanyl also.
Yeah.
When people are, being released after being in a care facility where they've stopped taking drugs, that's a time when many people use again and end up dying because they're not able to use the same amount of drugs. And frankly, laced with fentanyl, how about we just give them a strip to test to see if there's fentanyl in what they're using.
It's such an important conversation, Senator. Unfortunately, we got to leave it there for now, but perhaps we can have you back on, and maybe, who knows, someday with some good news on this front. Melinda Bush, thanks so much for joining us.
Thank you so much for having me. Have a great day.
You too.